Welcome back to Aging and Awesome. It's an unfortunate fact that memory issues are all too common as we age, and those issues aren't just hard on patients, they're very difficult for families. And we have Arbors Memory Care who deals with those cases every day. And Susie Kaczynski, she's with the Arbors, is here to discuss families that go into this crisis. And that's when a diagnosis comes down of Alzheimer's or dementia. Susie, you're dealing with the patient and the family. What are some of the first steps families need to take into consideration?
Certainly. Well, thanks for having me, Kai. I tell families to breathe first and foremost. They're in a crisis situation, and we want them to know there are resources available. And at Arbors Memory Care, we want to be a resource so that they have all information, somewhat a one-stop shop, so that they don't have to make 15 calls. We want to be able to communicate all the services in the Northern Nevada area so families can make the best decisions for their loved ones. But families can begin the process when the diagnosis is determined. It's really important to get the legal information in place, powers of attorney for healthcare decisions, powers of attorney for financial situations that may arise. Because once a diagnosis is done, then that power of attorney is legally bound to make the best decisions for their loved one. Educate themselves, hook into resources like the Alzheimer's Association and Dementia Friendly, so that they know what the future holds and what services are available to them when the time arises.
And you've been in the healthcare industry for many years. I'm sure you've been able to help a lot of families. I want to ask, because this is a common question, some people at home might have this. How do you know if you should be at home or at a community like the Arbors? Absolutely.
It's never easy to think of your loved one not being at home with you. But the two prime concerns are always health and safety. Is the environment safe? Is it secure? And then health. When activities of daily living require 24/7 assistance, that may be time to consider a community versus in-home care. So this isn't just a patient scenario, this is something that affects the whole family.
We have a very special guest in our live studio audience today who has experienced this directly and has sought help from the Arbors. Lisa Merrill. Lisa.
When your loved one has Alzheimer's, which is what my husband has, you think about the future a lot. You contemplate how long you can be a caregiver. The Arbors is the only facility that is 100% taking care of Alzheimer's patients. That is a really big deal to me. When I went to see that place, I was like, this is it. And I loved the activities that they have. So it's a very busy environment, which is good for him.
Lisa, thank you so much for your honesty. It is hard to make those tough decisions, and we really appreciate your consideration of Arbors.
Yes, thank you, Lisa. Thank you, Susie. If you'd like to reach the Arbors, you can. So by calling the number on your screen. Thank you again.
Very much.